Does a study conducted by researchers at the Cleveland Clinic provide an absolute direct linear correlation that the more COVID-19 vaccines a person receives, the higher likelihood that person has of contracting the disease, thus proving that the bivalent vaccine was a complete failure? No, that's not true. Dr. Nabin Shrestha, an infectious disease expert and one of the cited study's authors, told Lead Stories that it is incorrect to characterize the research as a direct linear correlation, and that the bivalent vaccine was not a complete failure. Rather, the study showed that the bivalent vaccine is less effective against more recent strains, and that further research should be done in other populations to see if the findings hold up, said Shrestha. A version of the claim originated in a video shared on Facebook on August 9, 2023, that showed Charles Hoff, a Canadian physician and anti-vaccine activist, presenting data from a Cleveland Clinic study. Hoff claimed the research proved that each supplemental dose of the COVID vaccine increased a person's risk of contracting the coronavirus. A caption that accompanied the video read, quote, "Canadian physician testifies the truth about the COVID anti-vaccine. This new type of vaccine turned out to be a complete failure. In fact, what they had created was not a vaccine but an anti-vaccine," expressed Dr. Charles Hoff. They Cleveland Clinic followed these 51,000 people for 3 months to see who was getting COVID. The people that had the bivalent booster, the one that's supposed to keep you the safest, they were getting COVID more than anyone else, he denoted. There was an absolute direct linear correlation that the more shots you got, the more likely you would get COVID. End quote. Below is how the post appeared at the time of publication. Source: Facebook screen grab taken Thursday, August 17, 9 hours 49 minutes and 29 seconds Coordinated Universal Time 2023. In actuality, the cited study found that vaccines have become less effective against new strains of the SARS-CoV-2, not that receiving additional boosters increases the risk of infection. The study that Hoff alluded to was published on April 19, 2023, in the peer-reviewed journal Open Forum Infectious Diseases. Titled, Effectiveness of the Coronavirus Disease 2019 Bivalent Vaccine, the study evaluated whether the bivalent COVID vaccine protected against infection. Lead Stories previously fact-checked erroneous claims made about the study findings when it was still in preprint in January 2023. A different version of the Facebook video was also shared on X, the platform formerly known as Twitter, by Children's Health Defense on May 12, 2023, and included false statements made during a May 2023 testimony to the National Citizens Inquiry, NCI, a group unaffiliated with the government that claims to be investigating Canada's COVID response. Hoff's statements do not represent the study findings. The study's authors told Lead Stories that such claims are not an accurate reflection of their research. Our study found an association between more doses of vaccine and higher risk of COVID, but these findings by themselves are not enough to say that these provided proof that each supplemental dose of COVID vaccine increased a person's risk of contracting the coronavirus. Study author Dr. Nabin Shrestha, a staff physician in the Department of Infectious Diseases at the Cleveland Clinic, wrote to Lead Stories in an email received on August 18, 2023. Shrestha added that it was incorrect to use the term direct linear correlation, as Hoff had, because the study was not a linear regression analysis. I would say our study found a statistically significant association between a higher number of vaccine doses and a higher risk of COVID, said Shrestha. But this doesn't mean that COVID vaccines decrease immunity to infection. More on that below. The study informs scientific understanding regarding the bivalent vaccine as opposed to the original monovalent vaccine. The Food and Drug Administration, FDA, reports the bivalent contains two parts, a component that corresponds to the original virus strain and a second that corresponds to the Omicron variant. To come to their conclusions, the Cleveland Clinic researchers looked at the frequency of COVID infection among Ohio healthcare workers during the Omicron wave in 2022. The positive correlation between the number of vaccine doses and infection risk doesn't prove that the vaccine caused that increase, but rather that the bivalent vaccine wasn't as effective against Omicron as it was believed to be. Shrestha told Lead Stories, quote, This study emphasizes the point that one should not assume a vaccine works against a circulating strain of COVID-19 without actually studying its effectiveness in that particular strain. The bivalent vaccine was not a complete failure.